Could you turn your music down, please?
What's the time?
Just past 12 o'clock.
Already?
Don't want to be late for your new friend.
You're just jealous.
I can look after my own car.
And I can't go until I found that journal article. Don't go without me.
Are you alright? Hello? Hello, can you hear me? Help! Ambulance, please.
I've organised that help for you. Stay on the line. I'm going to tell you exactly what to do next.
It's okay, I know. I've done CPR training before. I've just never actually had to do it.
I'm going to stay on the line with you. I want you to come back to the phone if you need further assistance or if you need me to explain the instructions again.
Okay, yeah. Thank you.
What's going on?
He's collapsed.
I'll get an ambulance.
No, there's one on the way.
Shall I get that machine thing to shock him?
There's an AED. Yeah, they've got it. Get it.
I'm sure I've seen one by the desk downstairs. I'll go and check.
Be quick! Right? Are you okay?
There's a bloke upstairs who's collapsed. Stop breathing. I need the AED. There's an ambulance on its way. Can you wait by the door and bring them to the second floor?
Okay.
I'll send a first aider right away.
Thanks. Here you are.
Right, just open the lid and switch it on, alright? I need to keep doing this. It'll tell you what to do.
I can't do it.
Look, it's really straightforward. Just follow the instructions. It's dirty.
Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
It sounds like an ambulance.
If you ever find yourself in an emergency situation like this, where someone appears to be unconscious, check for danger. Then check response. Gently shake his shoulders and ask him loudly, "What's happened? Are you all right?" If he doesn't respond, shout for help.
Help!
You need to open his airway and check for normal breathing. Take no more than 10 seconds to do this. If he's not breathing normally or you have any doubt, you must send someone to phone 999 or 112 for an ambulance. If you're on your own, you'll need to leave the casualty and do this yourself. Whoever makes the call should say that they have an adult casualty who's not breathing. Start chest compression without delay. Kneel by the side of the casualty. Place the heel of one hand in the centre of his chest. Then place the heel of your other hand on top of the first hand. Interlock the fingers of your hands and ensure that pressure is not applied over the casualty's ribs. Then you need to position yourself vertically above the casualty's chest. With your arms straight, press down on the centre of the chest 5 to 6 centimetres. That's about 2 to 2.5 inches. After each compression, release all the pressure on the chest, but without losing contact between your hands and the chest. Repeat at a rate of 100 to 120 times a minute. That's about 2 compressions a second. Compression and release should take an equal amount of time. After 30 compressions, you should give 2 rescue breaths. Open the airway again and pinch the soft part of his nose closed, using the index finger and thumb of your hand on his forehead. Allow his mouth to open, but keep his chin lifted. Then take a normal breath and place your lips around his mouth, making sure that you have a good seal. Blow steadily into his mouth. Take about 1 second to make his chest rise as in normal breathing. This is an effective rescue breath. Maintaining the head tilt and chin lift, take your mouth away from the casualty and watch for his chest to fall as air comes out. Then take another normal breath and blow into the casualty's mouth again. You need to give a total of 2 effective rescue breaths. After the 2 rescue breaths, return your hands without delay to the correct position on the chest and give a further 30 chest compressions, then another 2 rescue breaths, and so on. This is called cardiopulmonary resuscitation, or CPR. If more than 1 rescuer is present, change every couple of minutes so as not to get too tired. Only stop if the casualty shows signs of life or you become exhausted. Don't expect the casualty to recover at this stage. You'll probably need to continue CPR until professional help arrives and takes over. Remember doctors A, B, C. Check for danger, check response, shout for help, then open the airway, check for normal breathing, and start CPR. Doctors A, B, C. If you're unable or unwilling to give rescue breaths, then just do chest compression. It's much better than doing nothing at all. Whenever possible, use an AED, an automated external defibrillator. This gives a controlled electrical shock to the heart when appropriate. This may get it back into a rhythm that allows the heart to pump blood around the body.